Hello, I'm Heather Kenning, and I'm a Master's of Public Health student in the Epidemiology program at the University of Arizona. I'd like to share with you the work I did for my internship with the Arizona Center for Rural Health and their Project Share. Just to start off with, I'd like to thank my site preceptor, Elisa Padilla, and my faculty advisor, Dr. Chen, for their support with this project. So since the passing of the Affordable Care Act in 2010, the number of Americans without health insurance has dropped significantly due to Medicaid expansion and other cost-saving options. However, in 2021, 8.3% of Americans did not have health insurance at any point during the year. In Arizona, the rate of uninsured is even higher at 10.7%, leaving about 800,000 Arizonans without health insurance coverage. Without the protection of health insurance, people are left vulnerable to the high costs of medical care, and they either go without necessary care or incur high medical bills, which leads to unpaid medical bills as the #1 reason in the United States why people declare bankruptcy. So Project Share is a service learning program housed within the Arizona Center for Rural Health with the mission of increasing health insurance coverage in the state of Arizona. It's created in collaboration with students from the University of Arizona College of Medicine to address the lack of training provided to health profession students about health insurance, and particularly how to help their patients access health insurance. SHARE provides an opportunity for health profession students to learn more about the health insurance system in Arizona and to get hands-on experience helping to connect community members to health insurance resources. SHARE students go through a formal training program and have the opportunity to become licensed certified application counselors through the Arizona Department of Insurance. So the way that SHARE works is through a combination of community education presentations, such as our Health Insurance 101 presentation, community outreach events at events such as the Tucson Health and Wellness Expo or on-campus health promotion events, and finally, individual office hours or virtual appointments where a SHARE student meets one-on-one with a community member to discuss in depth their health insurance needs, and then the SHARE student provides the consumer with hands-on assistance with actually enrolling in coverage. For my internship project, I developed a program evaluation plan to help assess the impact Project Share has on the students we work with. So in collaboration with my site preceptor, we decided the 2 metrics we wanted to look at in this evaluation plan were, is SHARE effective at increasing health insurance literacy of SHARE students, and are SHARE students satisfied with the program? In order to measure health insurance literacy, we had to create an operational definition for the term. We decided, based off of literature, to measure students' knowledge about health insurance basics, their comfort with discussing health insurance topics, and their likeliness to discuss these health insurance topics. So in order to answer these research questions, I designed a mixed methods approach incorporating both typical quantitative methods such as our pre-test and post-test, as well as the addition of qualitative measures to address things like satisfaction, which was done through open-ended interview or open-ended questions on the post-test, as well as individual and group interviews with this year's SHARE students. So most of the data presented today comes from the pre-test, post-test administered first when students have been accepted into the SHARE program, and then once again in the spring after they've completed their training and started meeting with consumers. And then the interviews I conducted with were done at the same time as the post-test. So findings. For the 2021-2022 student cohort, there was a 13% increase from the mean score on the pretest to the mean score of the post-test, meaning there was a 13% increase in scores, which was statistically significant. The lowest score on the tests also increased, so the lowest score on the pretest was 7 out of 15, and the lowest score on the post-test went up to 11 out of 15. One of the more exciting results to me was that 100% of our SHARE students who took the post-test this year reported being comfortable discussing health insurance basics after participating in SHARE, which is, to me, is kind of the core of the program, not just increasing their knowledge and comfort with health insurance topics, but actually the confidence and willingness to go out and use this information with future patients or consumers. Along those lines, students also reported being more likely to discuss these health insurance topics after their participation in SHARE. I also conducted interviews with students from this year's cohort. I've included some quotes I found representative of just how overwhelmingly positive our SHARE students were. While there were some challenges regarding the length and timing of CMS required training, some obstacles with virtual appointments and trainings as we converted to, post-pandemic life of Zoom appointments, students overall reported really high levels of satisfaction with their participation and the knowledge that they gained as a SHARE student, and would recommend the program to their peers. So in conclusion, my evaluation report showed that this year's SHARE students' health insurance literacy improved and their overall satisfaction was high with what they learned from SHARE. One challenge I did find was in looking for longitudinal patterns. There were different evaluation metrics year to year. So for example, the pretest and post-test had different questions in past years, making it hard to compare longitudinal data. So the creation of my standardized evaluation plan will help with data consistency and create more comparable and hopefully more meaningful results going forward with the program. So I really enjoyed this internship. I have a huge thank you again to Elisa and Dr. Chen for helping me design an internship around my interests. Thank you to the SHARE students I got to work with this year, especially those who provided leadership roles. Thank you to the Center for Rural Health and the Western Regional Public Health Training Center for financial support. Thank you.